afternoon, Enid. It's Maggie Jackson with the Garfield County Health Department again. I'm thankful for the City of Enid for having me back just for a quick health update. It's been a little bit, and I just had some announcements for my community. First, I just want to revisit COVID-19. It's been a long road, but we have seen an uptick in our cases. I just wanted to show you this purple line shows that at the end of July and August, we started ticking up again following the state. And our cases grew and grew and grew as we had back to school and a lot of gatherings happening. But you can see at the very end, it's starting to tip over the top. We've heard from our hospitals that they're seeing less people in the hospital as well. So we are cautiously optimistic that our county will follow the rest of the state and get better. Unfortunately, we are now at 151 deaths from Garfield County. Again, those are verified as COVID-19 as the cause of death. Here in Oklahoma, we verified those before we announced them. And we have had, currently we're at 292 active cases. So a lot of people have COVID-19 right now in our community. I did want to show you, this is the last 90 days. So you can see that we had quite an increase right there at back to school, and now hopefully we're tipping down again. But that little pie chart, if you look really closely, basically the gist is that 25% of our cases have been ages 5 to 17. So it's our kiddos that are in school, the majority of those who do not have a COVID-19 vaccine. So if your kids live with your older family members, we just want you to be aware that being in school, being in gatherings has increased our number of COVID cases. So we're encouraging kiddos to wear a mask, wash their hands, and watch their distance while they're at school. But hopefully their numbers improve along with the rest of the community. I just wanted to update you that you are now in the majority of Garfield County. If you are fully vaccinated, we have 50.1% of people in Garfield County who are over 12 years old have been fully vaccinated. So we're so thankful for our neighbors that have made the choice to protect themselves and their neighbors, friends, and family from severe illness from COVID-19. Yes, you might have heard of someone that still tested positive after having a vaccine. Still, some people are in the hospital, but 91% of the people that are hospitalized right now with COVID-19 have not been fully vaccinated. So we are still encouraging you, if you have not yet had a vaccine, please go and get one. It's a good choice to keep our COVID-19 numbers hopefully continuing on a downward trend. Just in the state, we're at 56% have had at least one dose, so we're falling behind the U.S. at 64%, but you're now in the majority if you've had a vaccine in Oklahoma and in Garfield County. 25,000 people have had both doses or are fully vaccinated here in our county. So thank you to everyone doing your part to help this virus get better. There's been a recent announcement. We have been opened up to booster vaccines and third doses. So I wanted to do my best to give you the accurate information. There are some should receive a booster shot and some may receive a booster shot. So this new recommendation does not mean that the COVID-19 vaccine does not work or is not effective. It is effective, it's doing its job, it's protecting people from severe illness, but we know that a booster dose is showing some potential extra layer of protection. So people over 65 and older, and anyone who lives in a long-term care setting, like a nursing home, should receive a booster shot. Those are our folks who we know they're the most vulnerable. They need as much protection as they can get. Anyone who is 50 to 64 years old of age, can't say that again, 64 years old, that might have an underlying medical condition that puts them at higher risk. Those are things like diabetes and heart disease, obesity, any lung conditions, kidney conditions, liver conditions. We think they should receive a booster shot. Anyone 18 to the 49 who works in a high-risk setting, maybe with their job, if they're a healthcare provider, if they're exposed to COVID-19 often, or they have underlying medical conditions, they may receive a booster shot. So that is a booster shot right now. It is only authorized for the Pfizer vaccine. So if you had Pfizer more than 6 months ago, you can come for a booster shot. If you had Moderna, hang tight. We're still waiting on recommendations. So Pfizer only. If you meet one of those qualifications, come on down and get a booster shot if you would like to. People in that 18 to 64 years old group, if they can weigh their personal health risk. So talk to your provider. You may be at a higher risk than someone else, and then your provider may recommend getting a booster, having that extra layer of protection. So hang tight. If you had Moderna, we're waiting. Hopefully it will be authorized at some point in the near future. You can walk on into the county health department. We have walk-ins still for vaccine. If you haven't had a first dose, come on down. We'll take you. We did have an event on Monday just in case we had more people needing a vaccine. But at the health department, we can take you anytime between 8 o'clock and lunchtime, and then from 1 o'clock to 4:30. Because you have to wait a little bit, we don't want you to come right at 5 o'clock. We won't be able to have you then. But if you prefer to go to your another pharmacy, lots of local providers are available now. We're not the only ones, so you can call Walgreens, Walmart, CVS, many of our local pharmacies like Evans, and maybe even your healthcare provider has a vaccine available. So no shortage, they're available. If you've been waiting for whatever reason and want to get a vaccine, it's easy, and we can even bring it to you. If you would like a mobile event at your business, we'll come to you. Give us a call. I just wanted to highlight again that, we are all we're making our personal decisions about COVID-19. So as we have lots of sporting events, lots of holidays, we're just asking people to consider, do you have a high-risk personal health circumstance? Are you living with someone that does, that you might potentially put at risk? So look at where you are. Are you indoors or in a crowded event with a lot of people who might not be vaccinated? We're still encouraging you to take those precautions like wearing a mask and watching your distance. Just to talk about something else other than COVID-19, Infant Mortality Awareness Month was in September. This was a big issue that I cared a lot about in our community, and we have across the state of Oklahoma seen an 18% reduction in these are deaths of babies under 1. So we're celebrating that more babies are thriving in our state. But we're still encouraging everybody with infant mortality. We're looking at safe sleep, that babies have a separate, safe place where they can sleep. We're asking for moms to seek early prenatal care as soon as they know they're pregnant, and to quit smoking, take care of themselves, take prenatal vitamins. All of those things help prevent a potential poor infant outcomes. So Infant Mortality Awareness Month, I am personally celebrating that more babies are thriving across our state. That's a good thing. It's also Suicide Prevention Month. There's a lot of organizations in Enid that are here for you. If you or someone you know is needing help with their mental health, it is never a bad time to reach out. This is a national suicide prevention hotline. It's 1-800-273-TALK. We just share that phone number because every day there are people that are dealing with mental health and stress and anxiety, and we want everyone to seek the help they need. We know there's a lot of suicide prevention training, so if you are wanting to be a helper and help people avoid suicide, the health department offers the training, as well as St. Mary's Behavioral Health. There are lots of resources. So please reach out if in your business or in your church you want to be a part of preventing suicide. We all we all are part of that effort, and all it takes is talking and being willing to be a helping hand. So wanted to highlight a few other issues this month. Thank you, City of Enid, for allowing us to share health information and being a great partner during this long pandemic. Please share any questions on Facebook, and we will hopefully stay in touch, and we'll be back next month with some more updates for you. Stay safe, Enid.